That health care bill is a bad bill. It's not a health care bill, it's a health spending bill. And it's a situation that I think we're going to burden ourselves with. And I'm going to tell you right now, and I'm here to pledge, that I will work and spend almost all my energy on trying to repeal and replace that bill. You know, our health care, we're very fortunate. We have the best health care in the world, but it's also the most expensive. And I've always been told that whenever you have a complicated issue, and I think we'd all agree, and I know we probably tell our kids and grandkids this, when you have a complicated issue, you try to break it down into manageable parts. Now, we do have the best health care in the world. It's also the most expensive. If we want to increase access, which is really what we're trying to do in this country, because everyone should be able to have affordable health care, we need to lower the cost. If we lower the cost, we're going to open up access to people. And unfortunately, with this bill, right now, it is going to raise our premiums, it's going to raise our taxes, and it's going to raise our debt levels. Now, I would say this, I think there are a couple things we can do. We do say we want to repeal it, but we will replace it. And we're going to replace it with things that work. We're going to do things that are going to lower costs. We're going to allow people to buy their insurance across state lines. That means that's going to force insurance companies to compete for our business by lowering their premiums, but at the same time keeping healthcare quality high. I also think there are other things we can do. For example, I'm a big believer that we need to repeal state mandates. State mandates add thousands of dollars for every insurance policy in this Commonwealth and in this country. There are plenty of tests that are mandated by states that we take, that we have, that we never afford ourselves to. And that's wrong, and if we can repeal those mandates, that will lower our costs. And last but not least, I think we do need to look at reform in the medical malpractice. You know, there's a $54 billion savings when we talk about tort reform over 10 years, and that seems like, as Harry Reid said, it wasn't an awful lot of money. But at the end of the day, $54 billion is a lot of money, but the most important savings will come from not allowing doctors to have to practice defensive medicine.